Good morning, everybody. This is Lorena Hagenbart with the Center for Exceptional Families. I am the parent mentor for the North Central region of Arkansas, and we have six, my other co-workers have the entire state. There's six of us, and it's broken up into so many counties. And so anyway, we serve the entire state. And I always tell people, and I tell the administration, and I tell parents, what we actually are is a bridge. We bridge between the parents and the administration and other organizations to try to help parents understand how wonderful and unique their children are. And so, and try to make sure that their IEPs or 504s or whatever is needed helps their child succeed. And so my phone just went off, but today we have Renee Holmes again for part 2. Last time we had it for younger people with autism, and so they were able to understand the waiver. And as Renee will tell you, she had several already get on and get off and are getting services hopefully soon for ABA therapy and other things. Today we're going to be talking about transition resources for young adults and their families. And so just a quick synopsis: Renee is a nurse who works as the Director of Autism Services for Partners for Inclusive Communities in Arkansas University of Excellence in the developmental disabilities. Renee also is the Project Director managing the statewide autism waiver. You're so young. She has 20 years experience. She started at 2, working with children with autism, developmental disabilities, and chronic medical conditions in a clinical and state agency in the settings. She provides positive behavior support training and consults for provider agencies, school districts, and medical providers. She serves as a conference speaker and is a trainer on topics related to autism, educational advocacy, adult transition services, and she also presented regionally. Where did you go internationally, girlfriend?
We actually, the most recent one we did was at the PACRIM International Conference on Disability and Inclusion, and that actually was conveniently located in Hawaii.
Oh.
And it was before COVID hit, and so we were actually able to go and present there.
Okay. Well, without further ado, I think Katie's going to be sending you chats. Renee will tell you that she's going to be sending information via me, and we're going to post it on our website as well. I'll send emails out to you. So I'm going to close me out. All right, figure out how to do that. There you go, Renee.
Okay. Good morning. Like Lorena said, I'm Renee Holmes. I have lots of hats that I wear, but I'm also the parent of 2 now young adults. I'm the mom of a now 21-year-old with chronic medical conditions. And so we kind of practiced a little bit as she was going in from the pediatric services and youth services into adult services for medical type issues. And then I'm also the mom of a almost 18-year-old who I'm sure he'll be strolling through here at some point. He always likes to show up and make an appearance. Of a young man with autism and epilepsy. And so we are in the process now working through transition with school, with medical things, and looking at, planning for the future a little bit. And I've worked with the ladies at Centers for Exceptional Families for a very long time. And back many, many years ago, before I ever came to Partners, there was a lady that I met that I got to kind of sit and watch. And as she advocated with families, and recently in the last year, the Centers for Exceptional Families hired Karen Lutrick. And she was kind of my person, that she may not even know this, and that I sat and watched as she advocated for families and met with schools and helped families kind of find their direction as they were helping with their own children, and was kind of the person that I sat and watched and said, okay, this is how I need to do this. This is how what would Karen do? I felt like I needed to think every now and then. And so that was kind of neat when I saw that she was back at Centers for Exceptional Families. I was glad to see her back. So that they are a wonderful group of folks to work with if you all ever are looking for resources around the state. So today's, I can get my PowerPoint to change. Let's see here. There we go. Most of what I'm going to cover today are going to be Medicaid, insurance, and then just resources. We're going to hit on a lot of topics. I'm also sending some what I call my tip sheets that I've been using with families in the last year or so. I'm going to send those to Katie and Lorena, and they're going to post them for everyone on their website, which is great. If y'all are more than welcome, if you have questions about any of those, to let me know. But first I'm going to cover some things that everybody kind of remembers whenever they did the insurance changes several years ago. And one of the things that they changed was allowing young adults to stay on their parents' insurance plans until they were 26. The children can stay on their plans even if they get married, if they're not living with their parents, if they're going to school, if they're not, if they have their own job, if they have their own insurance at their own job, and if they have a child of their own. Their parents' insurance will not cover their child, but it could cover them as they are, working on planting their own feet and moving on into the adult world. So that is with all individuals, from 18 to 26 can participate in their parents' insurance coverage plans. And at 26, things do change. If it's a job-based plan, it usually ends at their birthday or the end of their month, at the end of their month of their birthday. Like, Kidder has a July birthday and it's in the middle of the month. And so hers would end when she turns 26 at the end of July. And if it's a marketplace plan, they will stay on that parent's plan until the end of the year that they turn 26. So they'll stay on there for quite a little bit of time, depending on when their birthday is. Coverage for adult dependents with disabilities varies by state. Arkansas doesn't require an insurance plan to cover an adult over the age of 26 if they have a disability. I've worked with lots of families who've been able to work with their private insurance and have been able to keep that child on the insurance plan as an adult after 26, but that's very case by case, and they are not required to do that. Another little bit I wanted to talk about related to private insurance is the Arkansas Insurance Mandate. This covers all individuals with autism, and it took quite a while to get through. It took 2 legislative sessions and a lot of lobbying, but it became effective on October 1st of 2011. And what it requires is that all state-regulated insurance policies cover autism-related services. Those self-regulated plans, like self-funded plans, some of the bigger in companies that do self-fund their own insurance, like Walmart and J.B. Hunt, the University of Arkansas, where we work, are exempt from the mandate. However, most of those folks have elected to start covering some of these services at levels similar to the mandate. It was one of those things that once some of the bigger companies started doing that, when Walmart and J.B. Hunt and Tyson started covering in Northwest Arkansas, some of the smaller self-funded plans started covering as well. So that's been a good route that they've followed. What the mandate requires is that it covers the diagnosis of autism, it covers ABA therapy, and there is an age cap for ABA therapy. And they will go up to 18 for ABA under the insurance mandate. Now, some may go higher than that, but under that mandate, it's 18 years with a annual cap of $50,000. It mandates that they cover pharmacy care, psychiatric care, psychological care, OTPT speech, those therapy services, equipment necessary for evidence-based therapy, And so I've had some families that we've helped navigate through with communication devices and some bigger equipment like that, and any medically necessary or evidence-based care deemed necessary by a physician. And so some of our families that I've worked with that needed like special compounded medications and things like that, that they've been able to work through with their insurance company to get those covered. Sometimes what I generally will tell families when they're calling their insurance company to have, you can print a copy of the mandate. If you'll pull up the Arkansas Autism Act 196 of 2011, they can pull that up. And sometimes that's really helpful for families and when they're talking to their insurance company, because they may get someone there at their, when they call their provider network office or whichever, that will tell them that they don't have to cover those things. And sometimes you're educating your insurance company because the folks there just may not understand that there is a mandate for those plans in Arkansas. Some of the Medicaid services I wanted to cover today some are pretty unique to Arkansas. Some are spread a little bit across the country, but many families that move into the state kind of find these as new and a little bit different than what they had typically seen in other states. But for children in Arkansas, the two I kind of want to cover in a bit will be SSI, which is a Social Security disability benefit for children who meet the financial category for their family and are also have a disability that's a SSI recognized disability. And also, we're going to talk a little bit about TEFRA, which, Arkansas, a lot of families utilize TEFRA in Arkansas. There's about 17 states that offer a TEFRA or TEFRA-like program, and Arkansas is one of those 17. And in Arkansas, they do require monthly premiums based on family income, but the family income is not important for eligibility. It's important when they look at the premium, but it's not so much for the family income for eligibility. And some of the adult services, Medicaid services I wanted to touch on a little bit will be SSI for an adult, Social Security benefits for adults, DAC Medicaid, which stands for Disabled Adult Child Medicaid, and it's kind of a one of those not very often heard of categories that it's rather important in some situations. And then workers with disabilities, which is a Medicaid category that's very not often used, and not often, many folks don't know about this category, but it can be very, very helpful for individuals with disabilities who also work and have an income that makes them over the limits for SSI. We'll talk about that a little bit more in a bit. For Social Security, for adults and children, your Social Security age that you change from the adult to the adult Social Security realm at 18 on your 18th birthday. And it's based on a qualifying disability, and that disability is verified through the medical review process. Family income is considered up until 18, and at 18, it's the individual's income. Even if you happen to become the guardian of their adult, the adult himself, herself at 18, it's their income that's looked at. If the family's income for a child happens to go over the SSI limits, that child can lose their SSI for that month. And we've had to help many families. I know some of the ladies that have logged on that are with the children with chronic health conditions. That's something that we would navigate a lot with families that would have SSI, and then they would lose their SSI for a month. And so we'd kind of have to help them make sure to have that Medicaid coverage picked up by another category like TEFRA. Families can't have resources over $2,000. It's over $3,000 if it's a two-family home. And one of the things that we would run into sometimes with families is that if they own land or a home that they don't live on, then that's considered a resource that would make them SSI ineligible for that child. So if they're moved here from a different part of the state and they're still waiting to sell their home in a different part of the state and have a home that they don't live in, that becomes a benefit or a resource and can kind of be a hindrance until we get that taken care of, or you look for a different Medicaid category. benefits when you have a Social Security Medicaid is a full Medicaid benefit plus that supplemental income that comes along with that. One of the things that we work with families a lot through transition are families who've had TEFRA for their young adult, and at 18 they can apply for SSI for this adult. And so that's kind of where we're at this point. You know, Carson will turn 18 in February. And so we're looking at these things of what do we need to get together to make sure we can apply for SSI for him at 18, because they'll look at his income, and you actually have a little bit of overlap time with your TEFRA. TEFRA will cover until their 19th birthday. So you have that year that you know you're going to have your TEFRA there while you're working on your SSI application and getting all that taken care of. DAC Medicaid is a Medicaid category that is rarely used except in the case where you have an individual with a disability who is an adult. They have to be over 18 and they have to become disabled before 22. And they lose their SSI because of a parent's death or disability, and they start receiving death or disability benefits based on the parent. SSI will fund the individual whichever benefit is higher. And so if they had a parent who happened to become disabled after their child became an adult, and that adult now receives benefits based on the parent's disability, and it's over the SSI income limits, that person would lose their SSI, and this would allow them to keep their SSI, or keep their Medicaid, they would be able to keep their Medicaid while still able to receive that benefit based from their parent. Those DAC applications are worked out of the county offices and can be picked up at any of the DHS offices, and they are returned to those DHS offices. When I've helped families with this type of Medicaid category, it generally was a pretty quick turnaround within 90 days, I would guess. And they were able to make sure those individuals didn't lose their Medicaid, and therefore their Medicaid related services like waiver and things like that. There's some information, the link that's on this slide, and I'll make sure Katie and Lorena get a copy of my slides too, because I do put a lot of links on this PowerPoint, and will take you to the information related to this type of Medicaid category. When you do, if you ever were to find yourself in a situation that you needed this category, most of the DHS offices have it listed as DAC Medicaid. It's listed as DAC online. And if you go in and they have a question and they're not sure, always talk to your county administrators. They're always very helpful, especially when you're looking at some of these less utilized Medicaid categories. The next one I wanted to talk about is a Medicaid category called Workers with Disabilities. And I didn't know a whole lot about this category until we had a USAID, which is, oops, I'm sorry, I went too fast, in another part of the country, call and say, we've heard Arkansas has this Medicaid category. We want to know more about it. And so I was kind of given the reins at Partners to say, figure this out and see what you can find. And it's actually become a very useful category for families and for adults with disabilities who may want to be able to work and have an income that's higher than the SSI limit. What you have to meet the SSI disability criteria. So you'll have to have a disability that meets those regular SSI disability criteria, but you have to also be working, and you have to have an income that makes you not eligible for Social Security. And in Arkansas, for their workers with disabilities, there's no earned income limit in Arkansas, and there's no resource limit in Arkansas. So individuals can utilize this benefit with an income. Now, at some point, there is a cost sharing, which you would have a copay or premium, kind of like TEFRA does for younger individuals. These applications can be picked up at the DHS office and are processed by those county offices. If the individual has had SSI before and has lost their SSI because of their income, but they still meet that medical eligibility, they don't have to go to medical review as an initial requirement. But if they've never been to medical review, the medical review team that does the TEFRA reviews and those kind of reviews in Arkansas will review their packet and make sure that they meet that eligibility criteria. I saw several chat questions come up. I'm going to check those and make sure I'm not getting too far ahead before we get back in. Let's see. We'll kind of touch base on the passes in a little more. Right now, these are mostly how to get a Medicaid category. One of the questions was, where do the passes fit in? These categories we've talked about here are just routes into Medicaid, and your pass will come into play if you meet those eligibility guidelines of needing more intensive behavioral health services, or are on the big CES waiver waiting list, or receiving CES waiver services. And so we'll kind of touch base on that a little bit on through. These are just your routes into Medicaid eligibility, and in order to get that eligibility determined. If you are in a pass, generally you have Medicaid eligibility, but we've had families who were in a pass and had an SSI eligibility, and then they run into a situation where a parent became disabled or a parent passed away and they started receiving those death benefits. And then you have to reroute a few into a different Medicaid category in order to keep their eligibility. And then they can continue on in their pass and receive those services that they were typically receiving there. Okay, let me get back to, my buttons aren't working so great for some reason today. Okay. I put these on here, and I know the ladies with the children with chronic health conditions know these forms. Back many years ago, Pam Hernsberger, who I think is logged in, and I were the pilot folks for Arkansas when they started working on their transition core, those core things that the agencies are required to work with. And she and I worked with the folks in central office really hard on some of the transition pieces. And so really what I wanted to put on here was, what do you know about transition for your child, and what do you not know, and what do you not know that you might need to know? Because a lot of folks don't even realize that there's things that they need to look at, and there's things that they need to talk about when your child starts becoming a teenager and an adult. And I tell families all the time that transition really needs to start with a diagnosis. When you have a diagnosis, we were diagnosed at 2 years old at Dennis Developmental many years ago with autism. You kind of first want to just, kind of circle the wagons and keep with your baby and make sure things are going okay right now. And then at some point you've got to say, okay, we've got to look out, and what is our plan? What are we going to do? We want to make sure, just like with our neurotypical child, that they are as functional and happy and supported as possible. And so when looking at that, then we start looking at how do we make sure that works. And so these surveys are just nice for families to have. And I know the ladies with the children with chronic health conditions will have these, and they work with their families with these. But if you ever needed to see one of these types of surveys, just to see, sometimes you just don't know what you don't know. And this may be something to look at and to, go through on your own or with your child, and see what it is that you really need to focus on. You may find things that, your child could tell you all about his or her medication, or maybe that's not something that's a priority because you're going to have to make sure that gets passed along for your child. But you may not have thought about insurance, or may not have thought about how we're going to do this when we turn 18. And so this will give you a little bit of information about that. And then one of the other things that we work on, and I probably work on this a little bit more even now, is that with the providers. And this is a nice flyer that you can even visit with your provider with, your pediatric providers, of what do we do next. And, one of the things that we've run into with my oldest, one of her chronic health conditions is one of those that is kind of a newer thing that not very many adult providers even know about. And so we're a little bit lucky, but it's kind of, she gets a little bit irritated that we're at Children's until they find a better fit for adults with this type of disability and medical condition. And so this is a nice way to be able to talk to some of those providers and say, what do we do next? You know, Carson's neurologist, there's neurologists that see adults that are very, very good. It's scary to think we're leaving the neurologist we've seen forever, but I know we'll be okay. It's just going to take a little bit of transition for him and for the provider and for me. You know I can call that neuro office and go, hey, here's what's going on, and we work through it over the phone, and it may be different at 18, and it will be different at 18. So this is just something nice that you can visit with your providers about. And also on that, there are some billing codes that are now available for providers to actually bill for some of the services to help a young adult transition. We actually are working and to see if those are going to be a Arkansas Medicaid billable code. And once we kind of know that, that'll be really helpful for these providers to say, yes, we know it takes a considerable amount of time, and we understand that, and this is, you know, you're able to bill for that time, meeting with a new adult provider and talking with them about the young adult, helping get those records together. And there were several things that they would be able to bill for if that becomes a billable service. Here are a few things that I found that I just really liked and that seemed really helpful. The finding an adult provider, that is a scary thing for a mom, let me just tell you. But it's okay. You will make it. I promise you will make it through. The Illinois Transition Project had a really great flyer about finding an adult provider, and it's pretty short. It's a couple pages long, and it's some nice questions of what do you even ask when you're looking for a new provider. And there are a few things on there that are Illinois specific. Just skip over those. The medical home portal is also nice. They give lots of good role playing and how do you talk to a new provider? How do you call a new provider and say, here's what's going on and here's what we need? And they give you lots of good advice on that one too. And like I said, I'm going to make sure that I get you these slides out to Katie and Lorena so that y'all can all have copies of them as well. Here's the finding an adult provider one from this is the Illinois one that I spoke about. And like I said, it'll talk about lots of those questions to talk to the office, talk to the doctor, talk to your friends, talk to folks in your community that may be using some physicians that maybe they like or maybe they don't, and you need to have a visit about that. And here are the billable codes that I talked about. I had my slides flip-flopped. These are the ones that the the medical doctors would be able to utilize if they become billable in Arkansas. There's also a transition CME for providers that explains some of that, you know, those things that they need to be able to work on with their pediatric patients, and what do we need to do to move to the next step, and making sure that's a pretty seamless transition from their end. It's a stressful time for families, so to have a provider that kind of helps you walk through this is a very important piece. The next few things are some handouts that a lot of families have liked to utilize in the past. And the first one is for those middle schoolers, you know, 13, 14, 15-year-olds, as they start to work on being able to advocate for themselves. That's one thing that we really wanted to make sure our kids both could do well. The one, she can talk you to the end of the earth about what she needs, I promise you. The other one, we want to really make sure he's able to advocate for himself. He may know what he wants. He may know a route to get there, but we need to make sure he understands how to pass that information along. And so we've worked through both of these workbooks with our kids. That was kind of my thing. I'm not going to share stuff with folks unless we've actually done it and it's workable. That was one of the things we found with some of the transition resources that as I would dig them up and look at them and go, you know, I'm a working mom. I've got a husband who works and kids who are busy, and, you know, we need to be able to do this and make sure it's done well and successfully before we tell everybody else to use it too. And so here's this one for the younger group. It worked through pretty quickly. It was something we did together. and something that we kind of talk through and work through some of the little role playing things. How do you, when you go to the doctor, how do you speak for yourself if that's something that your child is able to do? Or communicate. Is there a way that you want to communicate with the doctor? Do you need to write a note? Do you need to bring, have a communication device? Maybe set up and adjust it a little bit for a doctor's visit now. Whereas as a younger child, that wasn't something that they were doing on their own. Here's the one for older teens. It's really it's a great book. I had my oldest one do it as she got older, just as a kiddo with medical conditions, to say, you need to be able to do this on your own. I'm sending you off to college. You're going to live on your own. You're going to have to take yourself to the doctor on your own. You need to be able to do this and make sure that they understand your needs, and so they can take care of you appropriately. And so this was a great one that we did work through. We are currently working through it with Carson. It's a little bit slower than it was with her, but we have different kids and they have different needs. And so that's definitely something we're working with. And the Being a Healthy Adult has lots of role-playing exercises. This is something we're actually working on a lot too. There's good checklists. I'm a list maker and I like marking things off my list as I get them done. And so this is a really nice activity book for things like that, and also those role-playing activities. Carson really likes scripted language, and so it's trying to find those right things to teach him what to say in different situations, with his care, with, how do you call the pharmacy? How do you call the doctor's office? And when you go to the doctor's office and you check yourself in, what do you do when they say, do you have your insurance card? And the answer is not just stare at my mom. And so it's been working through a lot of activities like that to really, somebody's coming, you're fixing to have a guest, I'm thinking. So here is that book, and that's been a really helpful book. And some of the other things that I always make sure families are aware of, and that, those needs that change. And we were really good about our medical notebooks through school, and as we had our IEP notebooks and things like that. And then we've actually also developed some little smaller, easier to transport medical notebooks. And I think that's become a really big issue now, as we're seeing, families in the current pandemic. You need that information, and you need that information for everyone in your house, not just your children with disabilities. But there's a couple that the Vital Records Guide that's available through your Children with Chronic Health Conditions staff, your PAC representatives, and it's one of those. It's really nice, especially if you start it young, and work your way through with your child up through their adulthood. Some of the online ones that I really like. This is a link to one of my favorites, and it's nice because you just print what you need. We don't need tube feeding information, but somebody else might. We do need seizure precaution information. Well, somebody else might not. So this is one of those, you can pick and choose the areas you need and print those off and make your own notebook, or you can also save it as an electronic document on a flash drive. And it looks like this. You just click the information you need and you work your way through it. You can type it all out, and that's easier for me to do than sit and write, because by the time it's over, you're not going to be able to read my writing. And so that's not going to be very helpful. And here's another, just a quick medical summary. It's a 6-page long, easy to, one of those things that I was just saying, it's easy to transport medical summary for individuals with disabilities and without. And it's one of those you can put together, put in a little notebook, you can fold it up, whatever it is, the best way you can hang on to a copy of that with you, and have that in the event you needed some medical care. Grandmas of my kids have something like this. My friend that helps me watch my kids every now and then, she has this. So if she ever, had Carson for a weekend and something came up, it would give her some pretty quick, easy information to look at. And the printable health passport looks a whole lot like the other one. It's just a 2-page one. Where we found this has been helpful has been at those doctor's visits, to have some of this information right in front of our face. He does really well, but sometimes in stressful situations, like everybody else, some of that information just kind of goes away. And so to have this and to have it in a quick, easy to read version for he and the medical provider has been very, very helpful. And some of the resources that I want to share for some independent pieces, this is through a a group that has a transition healthcare toolkit, and it talks about it's autism specific, related to information about making an appointment, how to go to an appointment independently. We've not got there yet with him, but we definitely, I have to sit on my hands and make a point not to talk, and it's hard for me sometimes not to talk, and allow him to do that on his own. And then I wanted to make sure everybody was aware of the services through Arkansas Rehab Services. Many families, especially families of younger children, don't understand that this is available and this is out there. Schools are required to pull Arkansas Rehab in as your children get older, but you definitely can call and talk to them and visit with them and know who your representative is in your area. They are the folks that help with those post-high school planning, post-high school education or vocation, career preparation, will help you navigate moving from high school to college, or moving from high school to a job, high school to whatever is going to come next for your child. They have lots of offices. They have 19 or 20 offices over the 75 counties. And the contact numbers I listed down here can get you in contact with your right agency and office. One thing I have learned is that they're based off of, for children that are still in school, it's based off of the county your child goes to school in. We live in one county, he goes to school in a different county. And so whenever I called, I was like, well, you don't have Faulkner County? And she goes, no, but I have Van Buren County. And so that's how we've worked with our rehab specialists for quite a little bit, and it's been really helpful. They have lots of funding opportunities to help families with school, with equipment you would need for school, or equipment you would need for a job, or those type of things. We've also attended some of their youth leadership camps. That was last summer, when you could go to camp away from home, and it was a really great experience for Carson. He had been to one other camp, but I happened to go with him too. And so this was our second camp, and we dropped him off at sign-in. He saw somebody he had met at the first camp, and that was the last time we saw him for a week. And so if they hadn't posted pictures, I would have no idea what he had been doing, because I would text and call and he wouldn't answer his phone, and it was lovely. But he had the best time and made friends, and has asked all summer about camp again. We've had to explain a couple times, there's not camp this summer. We're really, really sorry. Maybe next summer we can look at camp again. And these are the emergency sheets that are recommended by the CDC for emergency preparedness for individuals with disabilities. It's a quick and easy 2-page sheet, and the link that I've posted here also has a lot of their emergency preparedness planning for individuals with disabilities. What you would need in the event of an emergency, of a natural disaster type issue. We've been blessed and have not had to do that with our family. And I've known families who've had issues that they've run into. I was a clinic nurse in Northwest Arkansas many years ago when Hurricane Katrina hit Louisiana, and we had lots of displaced families that moved to wherever they could go. And we started seeing many, many families that had come into the Northwest Arkansas area who had been displaced from the hurricane with no medical information, no medication at all, calling and going, I need medicine for my child, and here's what's going on. And to have this available would be really, really helpful. And I remember thinking back to those days and going, I've got to put something together, because if anything ever happened and we found ourselves in this situation, I need to have that information for my child in something that I can grab in a purse as I'm running out the door. And here's a little bit of information. It's a lot of information on the CES waiver. This is a little bit we touched on earlier whenever somebody had asked about the passes. The CES waiver is, a lot of people call it the DDS waiver. Some folks call it the big waiver. I hear that a lot, the big waiver, or the waiver with a really long wait list. It does have a waiting list, and it is considerably longer than some other waiting lists. We got on the wait list in 2011, and we are, I think, about number 500. I checked a few weeks ago, and we had moved, we were under 1,000. So we have definitely moved on that waiver waiting list. And some of those things that families ask, well, what do you get with waiver? You get lots of care coordination, supported living services, which is what a lot of families are looking for, some of that staffing and some of that support in the community, to make sure their child can be as independent as possible, and that they can have assistance to care for their child in the community. They can do adaptive equipment, environmental modifications, consultation services. If there's something going on that you need to work with a specialist on for some behaviors or things like that, they can pull in a specialist with like a BCBA, a behavior analyst, to come in and work on some behaviors with your child or with your adult. This will cover them as long as they remain eligible throughout their lifetime. There are waiver packets that have to be completed and turned in, and those are done through DDS, and the link down below is their link for information based for the CES waivers and your regional folks that work those waiver packets now. And some of the other resources I wanted to share with families that may just not know that they're out there, and these aren't necessarily services that you have to be waiver eligible for. Some you have to meet their eligibility criteria, but may not have to necessarily be waiver eligible. And those are, there's an AR Choices in Home Care, and to qualify for that, the individual has to be 25 to 64 with a disability or 65 or older. Meet the financial criteria, meet nursing home admission criteria, and have a need in at least one of the available services. And those services down there are attendant care, home delivery meals, like a medical alert if they're unable to call for help if they needed that, respite, and environmental modifications. So if transportation's an issue, if ramps and lifts and bathroom modifications are an issue, those may be things for individuals to look at that may not necessarily need to meet the whole waiver criteria. And that link is down there below as well. Some of the other things I wanted to visit about real quick were the wallet cards. These are nice. They're information that is made available, and they're generally made available through local police departments. And not all police departments use the wallet card, but I do. Some around Little Rock and some in Northwest Arkansas do. It's definitely something you can visit with your local police department about, and it has information for your adult or child that would be able to pass that information on to a policeman if they were to find themselves in a situation that would be either they were lost or they were in a situation that somebody may not realize that they have a disability. And there's also one of the things I really appreciated when we got this for Carson is that there were videos and role-playing exercises of how do you tell a policeman I have a wallet card or I have information that I need to share with you. And then some of the technology-based reminders that I wanted to pass along that just are helpful for anybody that needs medicine every day or anything like that. And they mostly are medication schedulers or medication reminders that individuals can use, that can use them based on different whatever technology that they're comfortable with and they understand, and to help them do that, be sure to be able to manage their own medication in their own time if that's something that's important for you and your family. And for those medication management pieces, the technology reminders are great. Visual schedules are great. We'll kind of talk about that in a minute. Medication boxes, refill reminders, discussion about the appropriate use of over-the-counter medication. If one works, then maybe 10 would work better. That's one of those things that just any young adult needs to learn as they're growing up and learning to care for themselves, and how to read medication labels if that's something that's important. What do you need to look at on there for your particular child? This is what we use. Carson does really well with visuals. You really can't see the end of my file cabinet over there, but all those papers hanging on the end are visuals that he uses, one of which is learning to talk slow, and his reward is money. And so that's been really a great help, actually. But one of the other visuals that we've used is something that he wanted to be able to do on his own. He would hear his sister calling at her own medicine and decided that that's something that he's a big kid and he wants to do. And so this is what we use. And so this is our medicine bottles and these are our notes. But when his medicine bottle's empty, it's an emergency and he needs to let somebody know, because that was something we ran into like the first time. But whenever you got a little bit of medicine left, it's time to call the pharmacy. And we wrote down a script of what he needs to say. And then the pharmacy we use is from the pictures when we lived in Northwest Arkansas. It was a little mom and pop kind of place. And we started calling in the evenings when we knew they'd get their voicemail and practicing. And so he would call and practice and leave a voicemail. And then after we did this a few times that way, then we called and talked to the person, which was good because they understood what we were doing and were really a big piece in our community, our extended community for him, of how are we going to make sure he transitions well. And this was a big thing of how do we care for ourselves, how do we communicate with others, and all that kind of those big things that as you're trying to teach an individual that might learn those things differently than a neurotypical individual, it becomes really important. And then his last thing was he had to put a note on my computer so I would know that he called it in, because we got so good at it that Mom didn't realize he was doing it some of those times. And then the next slide is about Medicaid transportation. I know this changes some as they do and as they update contracts, but the link that I can usually find the best flyer is the one listed there. And that's kind of one of those, changing things that has happened with COVID. Some of the transportation has become a little bit more difficult, but if you do need transportation, your child as they become an adult are wanting to do these things and do some things on their own, that can become a really big piece. That's going to be a big thing that we're going to work on, because with our seizure disorder, we're not able to drive. So transportation is a big thing at our house. And another piece that has even become more important during the COVID pandemic has been the phone availability through the Lifeline phone services. And this is something that if you have an active Medicaid, generally you are eligible for. And right now, your telehealth visits, you need to have a reliable phone source. Many families are doing, grocery pickup and things like that. So having an ability to call and arrange pharmacy, call and arrange your medical care and things like this, when many places are shut down, have become a very, very big piece of some of those needs that families are voicing to us. If I have a telehealth appointment and it's at the end of the month and I don't have the money to go buy more minutes, what else can I do? And so this has been helpful for families that know that they have that resource out there. And another piece I wanted to visit about a little bit, and this is one that I've learned more about more recently in helping with one of the COVID grants that we're working on at Partners, is through TAP, the Telecommunication Access Program. And if you ever really look hard at your phone bill, there are fees that everybody pays that go towards TAP for the state in those fees and taxes that you pay on your phone bill. And what it is it allows specialized telecommunication equipment for individuals who are deaf, hard of hearing, who may have multiple sensory deficits, who have speech, visual, mobility, intellectual impairments. There's a variety of things that they provided. I naively thought they only provided services, telecommunication services for those who were deaf or hard of hearing. But what I've learned is that they also have many other services and many other devices available for those folks who may need a smartphone in order to communicate via text, or have another device that may be necessary because they may have an intellectual impairment, and looking at a telephone with numbers on it may not be very useful for them. But if you have a smart device that has pictures, that's great. That would work. They have lots of different resources available. And so I wanted to make sure folks were knowledgeable about this. They will help the individuals with their device, whatever kind of device they find is necessary. And they will put on whatever apps need to be put on there in order for that individual to communicate. So if there are devices and communication type apps that are needed, they can help cover those for families. There is a $50,000 not so much limit, as at $50,000 there's a cost share. If you make more than $50,000 a year, the individual will be required to have a cost sharing piece in that. But under that amount, they appear to be covered 100%. And the Smart 911, that's another little piece I wanted to make sure everybody was aware of. It is statewide now. It was only in a few counties, but now it is statewide. And you can put all the information for your household on there. You know, we have one, and I've got on there that, you know, Kendra's here, Carson's here. Here's the things that you need to know with Carson, especially in the event of an emergency and police cars show up and an ambulance shows up. He may not want to come out. He doesn't know you. It's loud and it's noisy and it's scary. You may need to understand that he may be in his room and he may not want to come out or respond to you. And you can put things on there like we've got a dog named Possum who generally is really loud, but right now is outside, I guess. And so that they would know if you had a house fire, somebody needs to go look for your dog. So that's kind of a neat little piece of that. And then I wanted to throw out the information about the ABLE accounts in this to make sure families, especially families as your children are getting older and you're looking at resources in order to save money for your child, or now your child's working and they need to be able to save a little money on their own. ABLE accounts are available in Arkansas now, and they are still with out-of-state banks, and it takes about 15 minutes to set one up. You can set it up online, and it takes $25 to open an account. So families that had been a little leery of a trust fund, or didn't have the funds to set up a trust fund, they didn't have enough money, didn't have the money to go to a lawyer to get all that done, plus have money to put in one. This is available, and you can set it up online. You can deposit money over from your account and put some money in their account. It's actually, we did it the day they opened them in Arkansas. We did one, I wanted to make sure I knew how to do it. So if families asked, I knew how to do it. And just set one up for Carson. And it was a pretty easy process when you get online and do that. You can use money that you save in those ABLE accounts for anything that improves their quality of life. You can do it for education, health and wellness, housing, transportation, other expenses that you might come up with. I was at an ABLE account training with the Treasury folks, and somebody asked, can you buy video games? I'm glad Carson wasn't there, because they said yes, if that improved their quality of life. So we've not really passed that along here at home, but because that's what he would use his money for. But anything, they said, the biggies that you couldn't purchase, alcohol or no gambling, anything like that with it, but anything that would improve their quality of life that they felt was important. So I always want to pass this along to families, because this is a route that you can save money for your individual or your child, and help protect their Medicaid and their benefits that they may need to utilize at some point. Some of the legal resources I wanted to hit on real quick, just to make sure they were out there. Many families know about guardianship, and I did this training for folks in Mississippi too one time not long ago, and I left Mississippi in this one. But there's also supported decision-making. And this is become a really great resource for families who need to be able to help their individual, help their adult through some of these processes, but don't want to pull some of those benefits that your individual might lose if you become their legal guardian. Like you're not able to vote in Arkansas if you have a legal guardian, and that's something that's important to many, many people. And so I put a couple links for information on the supported decision making. I think that could be a whole training in itself, but that's available there. That's something that a lot of the folks out that are working with individuals with disabilities don't understand the supported decision making access and abilities. That's we kind of, I think, scared our school when they said, "Are you going to become Carson's guardian?" I said, "No, we're going to do a supported decision making plan." And so it is something that we've been able to help and educate some folks about. The next few, I'm going to try to get through these last few slides pretty quick, and then I'm going to get to the chat box. I just wanted to pass along selective service, regardless. All males over the age of 18 have to register with selective service unless they're hospitalized. The link to that I put up there is the link that discusses that. a lot of folks, sounds really makes me nervous even, but that is something that will have to happen at some point for us. And then legal aid, I've listed their information there, and then Disability Rights Arkansas, and they can help if y'all have questions about supported decision making or need some of those supports. Those are definitely some folks that can help you with that. The ULR mediation group, they're a really great group if you're needing help with some of these transition issues related to school, related to employment. As your young adult is moving up into the big people world, which is scary, they can help come in and help with some of those transition pieces if that becomes an issue. And the next few are just some really great links to just real specific condition-specific transition materials. There's some really great links there. And the Governor's DD Council has links available with information for folks, and the Parent Advisory Parent Advisory Council, they have lots of really great transition flyers available for families. And then I've got a lot of these in Spanish, and these are just the next slides are just the links for a lot of the things we talked about today that are in Spanish. If you have families that might need some of that information in a different format. Okay, and somebody asked about personal care hours, and personal care can be covered under the different Medicaid programs. SSI and TEFRA can cover personal care if that's found necessary by the physician. And you can also get personal care services through your PASS or under waiver. It varies based on the needs of the individual and what they might find necessary for that individual at times. And under the PASS, we've been able to utilize some respite funds under our PASS, even though we're not on the big waiver yet. And so we are able to utilize a provider agency who is staffing us with individuals to help care for Carson when we're working or when we're not at home. And that's been a big piece for us, a big help. And then somebody asked, just to clarify, Arkansas, yes, Arkansas acknowledges supported decision making. And if you have questions that are real specific about that, the links I provided that I'll get out to everyone will take you to some more Arkansas specific information. And then if you're having issues with that, legal aid, the DRA, Disability Rights Arkansas, has a group that's really working hard with the folks that are looking for supported decision-making choices. And legal aid will help with guardianship. That's another question someone had. You can call and visit with them. They do have some financial eligibility guidelines, but most families that I've ever had that worked with them, they were able to either do that on a pro bono basis or relatively much more cheaply than they would have to do if they had gotten a private attorney. All right, that was a lot of information really quick. I'm sorry I flew through some of that. This slide is my contact information, and you are welcome to call if you have questions. You're welcome to email. I do a lot of training and a lot of travel, and so email sometimes is the easiest way to get me because I can answer you really quick in between things. But if you need to call and visit about something, you are more than welcome to call, and we can help talk through things. A lot of what I do every day is just helping families navigate. And so sometimes it's just, visiting and figuring out what's important, what do you need, and how do we get there. We make lots of lists. Let's make a list. Let's write this down, get these done, and get back with me. And we can go from there. And if anybody, like I said, if anybody does have further questions or something kind of, triggered a thought and then you want to visit with it a little bit more, feel free to call. I'm going to get these slides, since I have so many links in here, to Lorena and Katie, and I'll get my tip sheets over there too. And they're about 13 pages long, and there's a little one page. Some of them are a couple pages, but most of them are one page sheets about different topics.
Well, thank you, Lorena. That's me. Thanks, Lorena. Thanks, Renee, for doing this. I just have, I wrote a question down. When you talked about the transition, do you want to speak on the fact that they have to have the IEP transition before 16?
Yes, and that's kind of where and that should be kind of when they'll pull in Arkansas Rehab Services, and your child at that point, if they're still 15 or 16, will should be a part of that if at all possible. We generally, Carson's been a part of his IEP meetings for the last several years, and we generally will kind of meet together real quick, and if there's anything we need to touch on that may not be something that he would something we don't really want to visit with about or to go in that far about. In the past, we would kind of talk about that real quick as we brought him in. But he is a big part of his IEP meetings. And right now I'm kind of letting him run those. But you need to make sure that before their 16th birthday, that you're looking at meeting with the school, getting those resources ready for what's our next plan, what's the next step. Where are we going from here? And if it's staying in school a little bit longer than their typical peers, that may be a thought. If it's jumping out into the work world, that may be a thought. We're kind of doing a little bit of both. He's got a school that has a really great vocational planning program. And so we're going to walk with our class. At the end of next year, we hope we get to graduate with everybody else. We're going to walk with our class. And then he's going to come back to high school for another year or two. That's what he thinks is an intern. He's going to be back as an intern, and he's going to do some of that job training. It's what our goal is, to come back and stay in high school till we're probably closer to 20, and then do some of that job training there, and then move on to community college.
Another question, when you talked about the Medicaid and having $50,000 as a cap, if you make more than that, is that for the individual or is that for the family?
If depending on the category.
Okay.
If you're looking at an SSI Medicaid for a child, they're looking at the family income. If you're looking at SSI for an adult, it is the individual's income. So like at 18, Carson's always had TEFRA since he was little, and at 18 we will look at going over to SSI, and at that point they won't look at our income anymore, they'll look at just his. And so that piece, with TEFRA, SSI, and those will vary based on the age of the individual. With TEFRA itself, it will be the child's income and resources are what's looked at for eligibility. So there's no income cap for TEFRA. Families can make very large amounts of money a year, and their child can still be TEFRA eligible. They will just have a different TEFRA premium than individuals who don't make that much. And then with the other types of Medicaids, the DAC Medicaid, the income for the individual can only be over the SSI limit because of the parent's disability income. And for workers with disabilities, there is no income cap. I had a couple of questions somebody had asked about. They were told once your child walks, you cannot stay in school after that. What we're gonna do is walk with our class. He will not be a graduate at that point though, but we will walk with our class and have our graduation ceremony with our peers that we grew up with. And so that is definitely something you can visit with the school about, visit with your IEP team, and look at those, what are we going to do next type of things. And if there's goals that they can work on at school that can be educationally related, yes, you can remain in school and work on those goals.
On a personal note, my son had SSI, and then my husband passed away. So the shocker was how big his SSI check was compared to what it was in the beginning.
Yes.
And so, and the ABLE account is an excellent way to, to move that so that it doesn't break. And so I just want parents to know that it will happen. I didn't know why it happened because it happened, he never lost a benefit. And then, of course, after he turned 20, he was on Medicare. So he has Medicaid and Medicare to help. Also, the other thing was, I know sometimes Medicaid doesn't pay for over-the-counter medications. So people need to be aware that they might have to have some money on the side to cover the
extra stuff.
And so we've had to do that.
Yes, and so that's definitely something those ABLE accounts can be used for. And it like you were saying, it's always something you never expect it.
Right.
And what I would run into families that would have an issue related to that, either it was a parent who passed, or they had a grandparent who passed who left money from life insurance to the child, thinking they were doing the right thing by making sure this child was going to be taken care of, and it really messes things up. Somebody did ask if in an ABLE account, can they have more than $2,000? Yes. In an ABLE account, you can save up to $15,000 a year. And I think you can have, I'd have to look back at my slide, either $100,000 or $150,000 a year, $150,000 saved into it before it would affect your Medicaid. Mm-hmm. With an ABLE account, you do have to report that as a resource to like TEFRA. We were TEFRA's test case because I said, we have this account, and they said, oh no, we don't know what to do yet. Hang on. And so we got it all together and got that to them. We have to tell him what we have in there every year when we renew his TEFRA, but it does not count against his resource limit.
It's the same with Medicaid. When my son has his burial policy, because we got a burial plan and not because he couldn't get a life insurance policy. Mm-hmm. So that's documented, ABLE account, any income that's sitting there. So that's just something. It doesn't go against him.
Like it's there.
It's a new thing. They were like, oh my goodness, where's that coming from? We all have to be trailblazers sometime, right?
Yeah, exactly. I called them one day. I was like, so we got this new thing, and I'm sure you probably need it. And they're like, we'll call you right back.
Yeah. The other is the guardianship. Uh-huh. I went through guardianship, and you do the guardianship, or you go to your county court house for that. So that you can get a lawyer. Medical legal partnership through the Children's Hospital also has it with legal aid, and they do have a cap, but they're willing to help you. And every region is different as far as the cost. So don't go with just one person. Call around to see. I didn't pay, but I think it was $600. It was $150 for court costs. That was, and unless you have a contested guardianship, which might cost a little bit more, but the
ones that I've heard that have had to pay have been around $600 or $700, and then many of the other ones that covered 100%.
Yeah.
So that's kind of what I've heard on most families that have told me about that.
But we'll probably do a guardianship and special needs trust, which I think we have that on our website. That John, I forget. Anyway, he was a lawyer. Last name is Smith. And so anyway, our webinar for that is on our website. For those who are still with us, on the 4th of August is another webinar that I will be hosting, and it's going to be called Emotional Dysregulation in Children, How Parents Can Help. And it's with Van Morris, who was a therapeutic foster parent training individual in Texarkana, excuse me. She now is in Little Rock, and she is the clinical supervisor for the Pinnacle Point. And I think this is going to be part 1 because she has so much information. And so that will be next Tuesday, same time, 10 o'clock. So we'll be sending that out. I didn't want to confuse anybody. I keep posting webinars after webinars. So, and they want to know what the website is. And I apologize because ours isn't on there. I think Katie might put it up. I'm not sure. But the website is www.tcfef.org. And that stands for the Center for Exceptional Families. And if you receive my email, it's all on my emails at the bottom. Is there any more questions? I didn't see. Katie, was there any more?
I didn't see
no, I don't
more.
think so.
Yes. Yes, the slideshow, we'll send that as soon as I'm able to, or Katie will be helping me. We'll also be sending you the, also for the next webinar. Also, another one that's coming up as soon as this teacher and I are going to be working on it, on the OWL program that's very successful in Conway and in Clinton.
That's the program that we're in too. That's why we're staying in school a few more years.
So look forward for that, because it's going to be, I asked her if she wanted to do Facebook or Zoom, and so she wants to do a Zoom with her coworkers to show parents how successful the OWL program is. And I always want to show things that are going to be giving parents a future and a hope. And so hopefully these things will be posted pretty soon. Okay, are there any more questions? I want to thank all of you for attending, and Renee, you rock. I keep
Thanks.
I learn something new every time we see things. So anyway, you all take care. We'll be closing shop now.
All right, we'll see y'all later.
Have a safe weekend and be COVID free.
Yeah, thank you.
All righty. Bye-bye, hon.